Welcome to Certificate Course in Healthcare Technology, CCHT. I am Dr. Jitulal Meena, working as a Joint Director in National Health Authority. My qualification after the MBBS, I am doing post-graduation in Quality Management and Hospital Accreditations, post-graduation diploma in Healthcare Law, post-graduation diploma in Public Health Management. I am also an NABH assessor and NQAS assessors, and especially I received just High Achiever Awards or Young Quality Achiever Award, and recently I also received the Man of Excellence Award in 2020. When we start for the quality, I think so. We are the pioneer for the quality improvement programs in public health sectors in Gujarat. And previously, I am working also as a state quality assurance officer in Gujarat. Now I am in National Health Authorities. The today's lecture is mainly on the NDHM, National Digital Health Mission. The learning objectives for the National Digital Health Mission's today's chapters is the first is the understanding of the latest development in the healthcare technology in the countries. And the National Digital Health Mission is the largest programs and which is the latest development of the healthcare technology in the countries. The key stakeholders of the NDHMs also we learn the objects. Third thing is the understanding of the key building blocks required to the digitalize the healthcare. And fourth, the integrations of the all NDHM building blocks for the comprehensive digital health ecosystems. So we want a comprehensive digital health ecosystem in India. Our overview of this session will provide an understanding of the National Digital Health Missions, which is launched by the Honourable Prime Minister on 15th August 2020. The session will give an overview of the vision of the National Digital Health Missions, objectives of the National Digital Health Missions, benefits of the NDHMs, guiding principles, stakeholders, modules of the NDHMs, which is recently implemented, like the Health ID, Digi-Doctors, health facilities, personal health record, electronic medical records, and we are also launching the pharmacy and others. The subtopics, first is the Health ID, which is covered by the NDHMs. The Digi-Doctors is also covered by the NDHMs. The Health Facility Registry, all the health facilities are registered in this NDHMs. Personal health records is also there. And the two modules, telemedicine and e-pharmacy, is on waiting. And in future, we are also implementing telemedicine and e-pharmacy in the NDHMs. What is the vision of the NDHM? Why we need the NDHMs? The NDHM, National Digital Health Mission, is the main vision of this to create a national digital health ecosystem that support universal health coverage in an efficient, accessible, inclusive, affordable, timely, and safe manner that provide a wide range of the data, information, and infrastructure services, duly leveling open, interoperable, standard-based digital health systems, and ensure the security, confidentiality, and privacy of the health-related personal information. The important thing is the efficient, accessible, inclusive, affordable, timely, and safe. The main vision is focus on the 6 points. The objective of the National Digital Health Mission is to establish state-of-the-art digital health systems, to manage the core digital health data and the infrastructure required for its seamless exchange, to establish the register at the appropriate level, to create single source of the truth in the respect of the clinical establishment, healthcare professionals, health workers, drugs, and pharmacists, to ensure the adoption of the open standard by all national digital health stakeholders, to create a system of personal health records based on the international standards, easily accessible to individuals and healthcare professionals and service providers based on the individual's informed consent. Because in the National Digital Health Missions, the main focus is the individual informed consent is main focus area. If individual cannot give the consent, all the data is not seen by the other doctors also. The other things to promote the development of the enterprise classes health application system with a specific focus on achieving a sustainable development goal for the health. To adopt the best principle of the cooperative federalism while working with the state and union territory of the realization of the visions. The main objectives is this. The another is to ensure that the healthcare institution and professional in the private sector participate actively with public health authority in the building of the national digital health mission through a combination of the prescription and promotions to ensure national portability in the provision of the health services, to promote use of the clinical decision support systems by the health professionals, to promote a better management of the health sector, leveraging health data analysis and medical research, to provide for the enhancing the efficiency and effectiveness of the governments at all levels, to support effective steps being taken by the ensuring quality of the healthcare, and last but not least, the strength existing health information system by ensuring their conformities with the defined standards and integration with the National Digital Health Mission. What is the benefit of the National Digital Health Missions? The benefit of the health missions to implement of the National Digital Health Mission is expected to significantly improve the efficiency, effectiveness, and transparency of the health services deliveries overall. The patient will be able to secure, store, and assess their medical record, such as prescriptions, diagnostic report, discharge summaries, and share them with the healthcare provider to ensure appropriate treatment and follow-up. They will also have the access to more accurate information on the health facility and service providers. Further, there will be have the option to access health service remotely through the teleconsultation, e-pharmacy. NDHM will ensure the individuals with accurate information to enable informed decisions making and increase accountability to the healthcare providers. The second important benefit is the NDHM will provide choice to individual to assess both the public and private health services, facilitate compliance with laid down guidelines and protocols, and ensure transparency in pricing of the services and accountability of the health services being rendered. The healthcare professional, what is the benefit for the national digital health missions, especially for the healthcare professionals? Because the healthcare professionals across disciplines will have better access to the patient medical histories with the necessary informed consent for prescribing more appropriate and effective health interventions, and the integral ecosystems will also enable better continuum of care. The national digital health mission will help digitize the claim process and enable fast reimbursements, and this will enhance the overall case of the providing service among the healthcare providers. The policymaker and program managers will have better access to the data, enable more informed decision making by the government, better quality of the macro and micro level data, will even advance analysis, use of the health biometrics, and better preventive health cares. And it will also enable the geographical, demographic based monitoring and appropriate decision making to inform decision and strength implementation of the health program and policies. What is the benefit for the researchers? Researchers will greatly benefit from the ability of the such aggregate informations as they will able to study and evaluate the effectiveness of the various programs and interventions. National digital health missions would facilitate a comprehensive feedbacks loops between the researchers, policymakers, and providers. What is the guideline principle of the NDHMs? One is the important things. First is the voluntary participations, because now National Digital Health Mission is not a mandatory; it's a voluntary participation. Signing up of the digital health accounts and generating digital health record will be voluntary and an option of out after signing up for the health IDs. The second important is the privacy and security by the design. All the building blocks shall be highly secure and compiled with the stringent privacy and constant based data sharing guidelines. So what is the important thing? Privacy is and doctors or public health facilities. The inclusibilities is again guiding principle. Specialized systems will be designed to reach out to the unconnected, marginalized, digital illiteracy, remote, hilly, and tribal populations is also very important. The seamless portabilities. Adoption of the internationally accepted standards such as the FHIR will play a pivotal role in the national portabilities. Educated and empowers. Yes, The comprehensive information system is there, education and communication strategy cell we developed through the appropriate communication channels to empower the users. And the last but not least, the wellness centers. The wellness centers and mobile screening teams will be strengthened by the access to the real-time health records. The key stakeholder of the NDHM. The main important that because NDHM is mainly focused on the patient and citizens. The key stakeholder of the NDHM is the first is the hospitals or clinics as a providers, lab or pharmacies as a providers, allied private entity like the insurers, healthcare technical companies, healthcare professionals like the doctors, modern medicine, including IOS, except yogas. Other participants is also there. For the third sectors, like the development partners or NGO or associates. So for the administration point of view, the regulators, the program managers is also there. For the policy maker, the state government and central government, all are the key stakeholder of the national digital health missions. How we prepare the ecosystem of the national digital health mission? You see the ecosystem like the hospitals, diagnostic center, and clinicals, health facilities, digital health facilities. They are registered. Then free basics, the NDHM EMR apps is there. The third party EMR web is there. The register to the participants and through the telemedicine, the consent managers and GW means without consent, you cannot give the information to the doctors or healthcare facilities. So the consent is must will be taken from the persons, and then workforce registry and facility registers there. And this is also the third party apps and partner and NDHM's mobile apps and portability is there. After give the consents, the healthcare providers see the all documents of the persons and they give the treatment accordingly. What is the health ID? Health ID is very important feature of this National Digital Health Mission. It is important to standardize the process of identify an individual across the healthcare providers. And this is the only way to ensure that the created medical record are ensured to correct individuals or assessed by the health information user through appropriate consent. In order to issue the health ID, the system must collect certain basic details including demography, locations, family and relations, and contact details. Ability to update contact information easy is the key. And the health ID will be used for the purpose of the identifying individuals, authenticated them, and creating their health records only with the informed consent of the individual across the multiple system and stakeholders. Without informed consent of the individuals, the information is not shared with any healthcare provider or any health facilities. So this is the health ID. Benefit of the health ID. The important things, because nowadays there will be no health records. If we see the personal health records, it's totally missing. And that's why it's very important. That's the benefit of the health ID, digital health record. You have the digital health records. Assess your information right from admission to the treatment and discharge in a paperless manner. Easy sign up. Create your health ID using only your basic information along with the mobile number and Aadhaar card. Very easy sign up. Voluntary approach. Yes, participants at your own free will be choose to create your health ID voluntaries. Voluntary approach also you can request insert to your data anytime. And easy to remember. You can create easy to remember health IDs and access your record seamlessly. Consent basis. The important thing is the consent basis, and that's why you maintain the privacy. Access to your health data to provide after your clear and informed consents, and you have the ability to manage and revoke consents if needed. Access to doctors. It's also very important. If you have the health ID, you access to the doctor, enable access to verified doctor across the country. Because then the Digi-Doctors, you have the Digi-Doctors ID also, and that's why you easy to verify doctors that is registered or not. Secure and private. Work with the remote secure and ecosystems mechanism, and no information is shared without your consent. The important thing is it's not shared without your consent. Child health ID, yes, create a health ID of your child and thus create Digi health records right from birth. That means you have the digi records from birth also. So it's a very important things, because nowadays there will be no any systems to take the records from birth. But after this NDHMs, you have these systems. Add a nominees. Add a nominee to assess your health ID and view the health manage your records. If you want to add name nominee that he will check your records, you will add. Inclusive access, ability to pupils with smartphones, feature phones, and even in no phones using assist methods. So each and every method is there. The reduce misidentifications. The health ID ensure medical records created for you are issued correctly to you, thus avoiding prescription and clinical errors. So this is the health ID, which is very important. Health ID is you will voluntarily created. Health ID is person based. All the digital records you have from birth to last, and all the medical record history you have. And if the important things of the health ID is without your consent, your information is not shared. You will also give the nominees that if you want to give the permissions to see your records to nominees. If you do not want, you do not give the consent, your information is totally safe and private. The second important feature of the National Digital Health Mission is the Digi-Doctors. Digi-Doctors means Digi-Doctors is registered in National Health Missions. All the doctors, medicines, and Ayush except yoga, all are digitally registered on the National Digital Health Mission. It is a single updated responsibility to the doctor enroll in the country with all the relevant detail of the doctor, such as the name, qualification, name of the institutes of the qualification, specializations, registration numbers, with national and center or state councils year of experience. This is an essential building block of the digital health infrastructure of the country, and the registry need to keep up to date as doctors gain skill by fellowships and map them in the facility they are associated with. After this digital Digi-Doctors, you know that how many doctor is there in this area, how many specialists in there in this area, and each and everything is online. Benefit of the Digi-Doctors. The digital health records, the important things, on demand access to electronic medical record for the seamless storage, sharing, and retrievals. The go paperless. It's the important thing is the paperless schemes. The access and signing the e-prescriptions, diagnostic report, discharge summary, and e-claim digitalizations. Development online presence. Share your specializations, working hours, and online ability. Connect with your patients at mutually convenient time. So it's a very important and very benefit for the doctors also. The telemedicine consent. The eligible doctors can treat patients remotely through the telemedicine and develop their online practices also. The other benefits like the purchase services such as the liability insurance online, other government services will also able to the digital. The third important thing of this National Digital Health Mission is the health facility registry. All the hospitals should be registered, including laboratory, including pharmacy. It is a comprehensive responsibility of the all health facility of the country across different system of the medications. It includes both the public and private health facility, including hospitals, clinic, diagnostic laboratories, and imaging centers and pharmacy, etc. The registry is centrally maintained, store facilities, exchange of the standardized data of the both public and private health facility in the countries. The registry allow health facility to assess their profiles and update it periodically with specialties and service they offer, as well as provide a secure common platform to facilitate to maintain all essential information. The facility would be able to e-sign documents such as the patient record, apply for empanelment, have easier claim processing, etc. It's a very important thing that if you registered your healthcare facility, each and everything is there. Oh, what is the benefit for the health facility registry in the National Digital Health Missions? The building trust and reputations. Listing on the national platform or the verified health facilities. At the national platform, you will see your facilities. So it's really a proud moment. Assess of individuals. The automatic listing of the health facility on the searching engines with the geolocations. It's very important. The geolocations. If anyone want to search your facility, your location is there, and that's why the individual or any person can go your facilities if you give the proper services or not. Go smart with the paperless operations. They provide digital health records to the patients. And that's why the paperless, totally paperless, transparent, easy to doing business. The paperless registration and renewal of the license easy in panel with the insurance agency and TPA. Nowadays, each and everything is online, paperless, transparent, and easy to assess your all the certifications and easy to update your certification also. The telemedication readiness several patients from all over the countries. You will get the telemedicine readiness also facilities. The another NDHM, because nowadays only we focused on the three. First is the Digi Health, second is the Digi-Doctors, third is the Digi Health facilities. The another modules in the National Digital Health Missions is the personal health records, electronic medical records, and telemedications, which is upcoming projects. What is the personal health records? If a personal health record is an electronic record of the health related information on an individual that conforms to nationally recognized interoperability standards and that can be drawn from the multiple sources while being managed, shared, and controlled by the individuals. The most silent feature of the personal health records and the one of the distinguishes it from the emergency EMR and EHRs is that the information and content is under the control of the individuals. The important thing is that each and everything is controlled under the individuals. The functions that are supported by the personal health record systems are those that enables an individual to manage information about his or her health cares. So a individual can be managed his or her healthcare systems. Electronic medical record is also very important. An electronic medical record is the best understood as a digital version of a patient chart. It contains the patient medical and treatment history from single health facility. The electronic medical records allow clinicians to track data over time, easily identify which patients are due to preventive screening or checkups, check how their patients are doing in certain parameters such as the blood pressure reading and vaccinations, monitoring and improving overall qualities of care within the practices. And the general approach is to create a web applications which operates on a set of standard like the construct, data construct, interoperability standards, and standard medication technologies. And the electronic medical records wishes to be the comprehensive view of the patient healthcare information at a given facilities. The reference of the digital health missions. If you go in the National Digital Health Missions websites, ndhm.gov.in, each and everything is available. But my humble request, especially for the second National Digital Health Blueprint, ndhm.gov.in home, right? Especially National Digital Health Mission print is there. NDHM strategy paper is also there. The key modules is also available. NDHM guideline principle is also available. Media and press releases are also available on these websites. Some of the videos which is very important, how you health ID registration, how the doctor registration is functional, how the healthcare facility registration is there. So each and everything is available on this video. If you go for this video, doctors digital health missions, the video is available. Health facility registration video is also available. What is the recap and take home message? The important things of the National Digital Health Mission is very important. That establish state of art digital health system for managing health data. If we see that present, there will be no proper data health management systems, and that's why it's a after this National Digital Health Mission is the state of art digital health systems for managing the health data. Improve the quality of the health data collection, storage, and dissemination. It's very important things because when any patients come to one doctor, then another doctor, then another doctor, but nowadays there will be no proper documentation. Previous documentation is there, but after this digital health missions, you have your data, you have your privacy, you give the consent, and you will manage your data. And that's why the quality of the health data collection, storage, and dissemination is very important. Provide a platform for interoperability of the healthcare data. It's also very, it's provide the platform for the interoperability and the faster creation of the update and accurate health register for the entire countries, health register for the entire country, which is nowadays there will be no any registry of the countries. The create provision to measure quality of the care, progress against the policy initiatives, and sustainable development of the goal. It's a very important key message. My humble request to assignment to all my colleagues, the analysis, the challenge and variant adoption of the national digital health missions by stakeholders across the country, because it's just a new uh, programs which is launched by Honourable Prime Minister, but it's very important and very effective programs to actual manage of the health system in India. They provide recommendation and key actionable points to ensure that the National Digital Health Mission is adopted by the all stakeholders and its success. The analysis should take into the account the present status, rollout in the UTs and awareness of the National Digital Health Missions, the perceptions amongst the stakeholders, and this can be done based on the informations available in the public domain as well as the researchers. So this is the key assignment for you. So when we join together, we will success this national digital health missions. Thank you very much. Thanks a lot and best wishes for future.